Good evening. I'm Ann Pelagia, a member of OLLI at SOU, and like to welcome you to the final program in the Cardiovascular Health in You series. Tonight's speaker, Dr. Kent Dauterman, will be providing us with a broad perspective on how to live to 100, not just by keeping our hearts healthy, but also by cultivating habits that will benefit all the systems in our body. On behalf of Ollie, I'd like to thank those who have made this series possible, Asante for arranging the speakers and topics, the four presenters from Southern Oregon Cardiology and Asante Cardiovascular and Thoracic Surgery, and Dr. Stephen Hirsch, our moderator. It's my honor to introduce Dr. Hirsch and acknowledge his long years of service in the Rogue Valley as an internal medicine physician and hospitalist, as well as serving in a number of administrative capacities, most recently as Director of Medical Affairs for Asante Ashland Community Hospital and Asante's Medical Director of Quality and Patient Safety. Over to you, Steve.
I appreciate the kind words. We are honored to have Dr. Kent Dauterman with us tonight. Dr. Dauterman's first job after graduating from the University of Toledo was as a Peace Corps volunteer in Africa before he went on to Johns Hopkins University School of Medicine to earn his medical degree. He then went cross country to UCSF, where he did his internal medicine residency and then cardiology fellowship, and then served as chief resident and chief fellow. His most recent training was 2 years at the Cleveland Clinic as a fellow in interventional cardiovascular medicine. So the Rogue Valley and Asante in particular, and our patients especially, were very fortunate to have Dr. Dauterman come to the Rogue Valley and work with us. He performs coronary interventions and minimally invasive valve procedures. He helped establish the carotid stent program and the minimally invasive valve program. He co-directs the STEMI heart attack program, as well as the structural heart disease program at Rogue. And he has served as cardiology chief both at Asante and at Providence. Dr. Dauterman has a lovely family. He's married to a wonderful teacher and has 2 children. He previously coached the high school robotics team where his kids were and is now enjoying beekeeping. I'm privileged to call him my friend, and I'm delighted to introduce Dr. Dauterman, who will tell us how to keep your heart running until 100.
Great.
Kent?
Hey, thanks, Steve. That's a really nice introduction. Very kind of you, and certainly have enjoyed our friendship over the past 21 years. Hard to believe it's been that long. Anyway, so welcome everyone. I hope this is worthwhile for physicians. For non-physicians, I think you'll find it worthwhile. It's the hook here was calling it "Living to Be 100." I had that title. Probably another title is "Maximizing Your Chances of Staying Healthy." And actually, this is a talk I gave to my children this summer. One of them's 28, one's 24, and I thought, if I kicked the bucket, what would I wish they knew? Because
Battery 50%.
Being the physician in the family, you get an awful lot of questions and how do you help navigate people through the medical system or issues they have. And they're both in computer science, both the kids, and my wife's a teacher. And I thought, boy, if something happens to me, I'm not sure they're going to be very savvy about things. So you could also call this talk "What I Want You to Know in Case I Kick the Bucket and You Don't Have a Physician Right There to Help You." Here we go. This is not a talk exactly about the fountain of youth, although there's been a lot of effort through the years to find the fountain of youth. These people did find the fountain of youth, and they drank some of it, and then look how young they look. They look great. There's also the story of Gilgamesh, one of the oldest hero stories, 4,000 years old, and about a king's search for immortality. There's some more recent folks who look for immortality. If you split your soul in 7 ways, you notice you don't look so good. So don't do that. And then there's also other things in America, we think we're going to get to 100. You know, if you go to the Heart Attack Grill in Las Vegas, you can buy a single bypass burger, a double bypass burger, a triple bypass burger, a quadruple bypass burger, and a lot of folks think, well, I can sit around and eat, but if I take a pill, I'll make it to 100. And just FYI, that's probably not going to happen. There's a lot of effort going into pills and genetic engineering. In fact, anti-aging research will be about $610 billion spent in 2025, it's estimated. So it's a hot topic, probably why there's so many folks here tonight. So the topics to cover tonight, number one, I'm going to do the 10 most likely things that will kill you. Number two, some anatomy and physiology, which I think non-physicians will enjoy. We'll talk about heart disease, cancer, obesity, and prevention. Number one, the most likely thing to kill you is heart disease. About 38% of people will die of heart disease. This is from the Center of Disease Control last year. Number two on the list is all forms of cancer. Number three is COVID. That probably will not be the case this year, but during the COVID pandemic, that's what it was number three. Number four are accidents, unintentional injuries. Number five is stroke. Number six is lung disease. Number seven is dementia. Number eight, diabetes and related issues. Next is influenza, pneumonia, and then kidney disease. So those are your top 10 killers that you want to try to avoid getting if you're wondering what's going to get you. I thought, first of all, we'd do some anatomy and physiology here. So this is De Humani Corporis, published by Vesalius, Andre Vesalius in 1543. This is one of the most famous anatomic texts. Before this, a lot of people thought about humors, like Galen and the like. So this was the first time where the human body was really broken down and dissected, and beautiful plates made. This is an example of the human body if you take the skin off. And you can just see the beautiful muscles in this. This, if you have tendon, joint, muscle, ligament issues, these are your muscles. Tendons attach your muscles to the bones, and ligaments attach bones to bone. So when someone says they have a ligament problem, it's a problem with the attachment of bone to bone. Tendon is attachment of skin to muscle. This is what a knee looks like if you open it up. Here on the bottom, you have your meniscus between your femur and your tibia, and you have this slick, glossy stuff here. You have your articular surface, and then you have if you look up here, you have your ACL. So you have this. Here's your anterior cruciate ligament, your posterior cruciate ligament. Your anterior cruciate ligament prevents your knee from going forward. Your posterior keeps it from going backwards. Might be backwards, I can't remember. Your lateral meniscus and your medial meniscus are on the sides. They keep your knees from going side to side. And then, like I said, you got your meniscus here. So you hear about people having meniscal tears and they shave off some of the meniscus. You hear about ACL, MCL tears. This is where all the action is. And this is how your knees are put together. And this is how you can see when you get degenerative joint disease, all of this connection between the femur and the tibia, it just all kind of wears out. And that's why people get knee replacements. This is what a hip looks like if you get a hip fracture. So first of all, you have your femur hooking into the pelvis. And then if you fracture your femur, it's a fracture of the femoral head right here. And the surgeon will either put a pin in or put a brand new joint in right here into your pelvic socket here. This is your shoulder. Here you have your humerus and your clavicle, or your AC joint is right up here. But these are your muscles attached by tendon to your humerus. You have a bursa. So you have all these connections here. And if you get a rotator cuff injury, you basically get tearing, usually of the muscle or of the tendon in here, and they'll repair these areas. And it's a tough surgery to do. So those are the rheumatologists and orthopedic surgeons help you with those issues. Rheumatologists are the internal medicine docs. The orthopedic surgeons are the surgeons who take care of those. Okay, so for skin, the skin is the largest organ in your body. If you flay someone and take the skin off, that's what it'll look like with the underlying structures. Melanomas, keep in mind when you're looking at the skin for asymmetry, irregular borders, irregular colors, and then the diameter being a certain size. So that's for melanoma, and obviously these are the dermatologists. This is your nervous system. Here's your brain with your spinal cord. And then you have your nerves. You have nerves going out to the muscles and sensory nerves going out. And you can see here, the longest nerves in the body are down to the toes. So when you get peripheral neuropathy and burning and tingling in your feet, you can see that that's most likely to happen in the feet because those are the longest nerves. Obviously, if you get in a traffic accident and transect your spinal cord, everything below that is not communicating with the brain. So that's your nervous system. So those are the neurologists and the neurosurgeons. You can also see if you get shingles and you have chickenpox virus come out of one of your sensory nerves out to one of these areas, that part of the body will hurt and you'll get pustular chickenpox lesions on your skin. So anyway, neurologists and neurosurgeons. This is your pulmonary system. So you've got your nasal cavity in your mouth and they all connect in the back. So if you get sinus drainage, that's why things run down the back of your throat. And then you have your larynx and your trachea, and then you go on down into your lungs. And this is a blow-up of that. If you have asthma, you have muscles constrict in the airways here. And so you take medicines to help relieve that constriction of the muscles and get rid of the mucus in there. If you smoke or have emphysema, these little air sacs, you're born with a certain number of air sacs. And if you chew up all those air sacs, or a lot of them, then you get short of breath. And if you chew up enough of your air sacs, these little things that look like grapes where oxygen exchange happens between the capillaries and the veins, or between the basically when blood travels through the lungs, the blood travels through capillaries and picks up oxygen and gets rid of carbon dioxide. So when you smoke, you chew up these little air sacs, and sometimes people end up on oxygen. So the people who take care of that are the pulmonologists and the thoracic surgeons. And then here's the cardiovascular system, in my opinion, the most important of them all. Just joking, it really serves everything. And obviously with the heart and the red arteries and the blue veins, really travel everywhere. And that's cared for by the cardiologists and the cardiothoracic surgeons. And then here's the GI tract. So everywhere from your mouth down to your anus, it's about 25 feet of plumbing, starting with your esophagus, which is a big muscle that shoves food down to your stomach. And then you have your liver, and then your small intestine, which then hooks to your large intestine. The small intestine extracts, well, first of all, your stomach has a pH of 1, assuming you're not on an antacid. So a pH of 1, which is very acidic, that breaks down the food. The stomach is a big muscle that grinds the food. It becomes this emulsion that goes down into the small intestine, which absorbs a lot of nutrients. And then by the time it hits the colon pulls a lot of water out. And then it comes down and you have a bowel movement down here. Here's your rectum and anus. Here's a close-up. Here's the gallbladder right underneath the liver. The gallbladder makes bile, which is excreted into the small intestine, which digests fat. And so here you get gallstones. If this gets infected, the surgeon does a laparoscopic surgery, puts a little clip here, and then just shells out the gallbladder. So that's how people get cholecystectomies. Here's your pancreas here, very much in the back of everywhere, tough to get to. And this makes insulin. Main thing it makes is insulin. And if you're a type 1 diabetic, you don't make enough insulin, and then you have to take insulin shots. Here's the spleen right here, important in the immune system. Very vascular structure, big artery going into the spleen and vein coming out. If you get trauma and you injure your left upper quadrant of your abdomen, you might rupture your spleen and the surgeon has to take it out. So the gastroenterologists and the general surgeons deal with those GI issues. In terms of the urinary tract, blood as it's pumped from the heart, blood comes down the aorta. Probably about, I don't know, 15, 20% of the blood goes through the kidneys that gets pumped out of the heart. And as it goes through the heart, or I'm sorry, as it goes through the kidneys, it's filtered there. And things that the body doesn't need go out into the ureter, which goes down into the bladder, out the urethra, and then out then it's urinated out. So these are the kidneys. They also do a variety of other things, such as makes hormone erythropoietin for making red blood cells and other important things. It has it communicates quite a bit with the heart. So nephrologists are the internal medicine doctors, and urologists are the surgeons. I'm covering a lot of ground here, so bear with me. This is the uterus, and which is right here, this big muscular structure, the uterus. Here's the cervix right here, and then here's the vagina down here on the bottom. Here's the ovary, and the ovary is what makes the eggs, which are caught by the fallopian tubes, which then the eggs travel down the fallopian tube. And here you can see, here's with ovulation. So the egg is released. It's picked up by these fimbriae, goes down the canal here and hooks up with the sperm if there's one there waiting for it. And you get conception, and then it travels down here into the uterus and implants. And you can see these are big muscles in the uterus. If you get fibroids, these are growths within the uterus, rarely malignant, but sometimes can cause bleeding and pain. And then when you deliver, the cervix, when you're pregnant, has a plug here, and then when you go into labor, that plug goes away, and you give birth through the cervix, out the vagina. And you can see this is the side view of a woman here. You can say here's the rectum with the anus. There's a lot of traffic here. There's the anus, here there's your vagina, here in the middle, and then there's your urinary tract. So here's your bladder, urinary tract, vagina up to the uterus, and then over here is the rectum and out. So there's a lot of traffic down here, and you can see why women urinary tract infections, if you wipe from back to front, you can easily get urinary tract infection. After you've gone through menopause and things are not quite as well lubricated as they used to be, things dry up, it's easy for germs to get from here up through this tract and cause urinary tract infections. So gynecologists and obstetricians help with that plumbing. For guys, plumbing's a little easier. Here's your bladder, here's your prostate, here's your testicles, here's your penis. Hookups are a little easier. If you get prostate cancer and you get your prostate taken out, there are a lot of nerves that go to the penis right in this area, and they try to do nerve sparing surgery, but sometimes people end up with urinary incontinence or erectile dysfunction as a result. So most common male cancer is prostate cancer right here. This is another view of the male system kind of uncoiled. Here's your testicle. Here are your vas deferens, your epididymis, and your vas deferens that go up, hook into so your sperm travel up this cord out through the prostate, into the urethra, and then out through the penis. This is the penis here. So if you get a vasectomy, the urologist cuts this here and makes a knot. Hopefully they make a good knot. And then if you get an enlarged prostate when you get older, which almost all guys do, not only does the prostate get bigger going outwards, but it also pinches inwards, and people get benign prostatic hypertrophy, BPH, and that can impact the flow of the urine out the prostate, out the penis, and out. So if you're getting up 5 times in the middle of the night, or you have poor urinary flow, your prostate's probably very big in this way, but also pushing in on your urethra. So those are urologists, take care of that. For blood issues, these are the red blood cells. They carry blood throughout the body. These are the clotting factors. You can see if you have an injury to your artery, there are platelets, and the platelets are usually little sacs that travel around in your bloodstream. They're very not angry. They're very They just kind of float around. If they see a roughed up area, though, there are things that activate these platelets, make them very angry, and they release all these substances that cause clotting, which in cardiology can cause heart attack. That's why you're on aspirin, so these things don't clot so easily if you have cardiac disease. And then there's fibrin strands. So if you have injury somewhere, you'll get fibrin strands and platelet and thrombin and other chemicals forming a clot. If you go under an electron microscope in the bottom right, that's what that's what a clot looks like. Red blood cells, fibrin, platelets. So that's what a clot looks like. These are white blood cells. There are different types of white blood cells. There are neutrophils, which kill bacteria and fungi, fungus. There are monocytes, which clean up damaged cells. There are lymphocytes, which fight viruses and make antibodies. So T lymphocytes, B lymphocytes. There are eosinophils, which are involved in the allergic response. They also deal with cancer cells and parasites. And then basophils are important in allergic responses. So all sorts of different white blood cells. This is your immune system and the lymphatics. You can see how everything's interconnected. So these are not your arteries or veins, but there's fluid that travels through these lymphatics, and these little lymph nodes here have all sorts of immune cells, and if any bacteria or other things travel through here, they get filtered out and killed by the lymphatic cells. If you get lymphoma, then these things grow, and it's either because the white cells don't die, or you're just they just keep replicating and don't stop. And you can see the spleen is an important part of the lymph system. So hematologists for blood disorders, oncologists for cancer. So heart disease. So I'm a third of the way through the talk. Okay, so heart disease. So anatomy, here's the heart in the middle. It does not look like a Hallmark gift card. You have your lungs here, lung here, so right lung, left lung. And if you open the chest, there's a sac that goes around the heart called the pericardium. It's a protective sac. There's like a tablespoon of lubricating fluid called the pericardial fluid that's kind of a lubricant between this. Sometimes people get a lot of fluid in the sac around the heart called a pericardial effusion, usually if there's some type of irritation, such as a recent infection, or it can be like a viral infection. Sometimes it's cancer. It can be all kinds of reasons people get a big fluid collection, and it can compress the heart. It's like putting your heart on a table, and then you put your hand on top of the heart, and it compresses the heart, and it does not affect how the heart squeezes, but it impacts how the heart fills. Again, another picture of the pericardium. So anyway, there are different types of pericardial disease. This is another picture of the heart from the front, attached to the different blood vessels, and another picture here. So the heart has some similarities to a car engine. This is an old Model T, I think. This is a Lamborghini. Yours might be somewhere in between. But there are generally about 90,000 heartbeats a day, and by the time you reach age 65, it's around 2 billion heartbeats. This is what a heart looks like if you have an echocardiogram. Here's your left ventricle, your right ventricle, your left atrium, your right atrium, your mitral valve, tricuspid valve would be over here. We get a lot of information, a lot of different 2D views of a 3D structure. This is someone who has a nice pump here. This heart muscle is squeezing nicely. This person has a nice V8 engine. This is a cardiac MRI. You can see the nice resolution, how the heart squeezes here. This is the left ventricle, the right atrium, the left atrium. So we get a lot of information here about muscle structure. Has someone had a prior myocardial infarction? Is there different type of scar tissue going on? We can tell how leaky a person's heart valve is by this. And then this is a picture of someone with a severely weak heart. This is again an echocardiogram, and you can see this is the left ventricle, and here's the right ventricle. The right ventricle is squeezing beautifully. The right atrium has a nice size, but the left ventricle, you can see, just does not pull in, does not squeeze well. It's become spherical, enlarged, and has a reduced pump function, what we call ejection fraction, the percentage of blood that the heart pumps out every time it squeezes. And here's an example. This is a cardiac MRI, and we're looking at the heart from the side, and you can see the entire heart just is not squeezing well. And most specifically, you can see this person's had a large myocardial infarction. The heart muscle should be this thick, but it becomes very thinned here. That means the heart muscle has died and become scar, and scar does not squeeze. This is another example. This is a bread loaf slice of the heart, and this is out in the lateral wall. Here's the right ventricle. Here's the septum. Here's the lateral wall, and you can see how thin this is here. This part of the heart muscle has died. This is a prior myocardial infarction. So that's the pump. The next thing we'll get to is the heart valves. And this gives you a little feeling for the heart valves. The heart valves are basically, they're like little one-way check valves. You can think of them. They're little flaps. They're very simple in some ways. They allow the blood to go forward, but if the blood tries to come backwards, it will shut the valve. And so if you were to take out somebody's heart valves, every time the heart would squeeze, half of the blood would go forward and half of the blood would go backwards. So the purpose of the valves is to keep the blood moving forward. The problem with these heart valves is they open and close 90,000 times a day. There are no days off, no vacation. So by the time you're 80, there are about 2.5 billion heartbeats, and these valves can wear out. And they can either become blocked up where they don't open well, or they can become leaky where when they close, they don't make a good seal and the blood goes backwards. It doesn't mean the blood's leaking out of the heart. It just means when the valve comes together, it doesn't make a good seal. So we see all those things. This is an example of a tricuspid valve right here. This is a pulmonic valve. So tricuspid valve, when the blood returns from the body, goes to the right atrium, the blue oxygen poor blood. The blood travels through the right ventricle into the across the tricuspid valve into the right ventricle. When the right ventricle squeezes, the pulmonic valve opens and the blood goes out into the pulmonary artery. Okay. And this is pulmonary artery. This is blue oxygen poor blood, but it's a red artery here. And this travels out to the lungs. And when the blood returns from the lungs, it goes from being blue oxygen poor blood to red oxygen rich blood. And when the heart relaxes, the mitral valve opens, allows blood to flow into the left ventricle. And when the heart squeezes, the blood will go out the aortic valve out to the aorta. So 4 heart valves. When they're all closed, this is what they look like. This is the tricuspid valve. That's on the right side of the heart that serves the lungs. This is the mitral valve, which is on the left side of the heart and serves the left side of the heart. This is the aortic valve, and this is the pulmonic valve. You notice they're all in the same plane of the heart. The heart has like a skeleton to it. And then here are the coronary arteries. Here are some of the fuel lines. This is the right coronary artery and the left main with the left anterior descending. This is actually the left circumflex. The left anterior descending goes down the front here. And this is when the heart relaxes, the tricuspid and the mitral valve open, and these are closed. Let's see here. Actually, and this is when the heart squeezes. The pulmonic valve and aortic valve open, and these valves are closed. There are no muscles, there are no motors, pumps, there are no ropes, gears, levers, or anything involving the valves. They're just simply little flaps. They just are one-way check valves and open and close depending on the direction of the blood flowing. These are the coronary arteries. These are the fuel lines to the heart. So when the heart pumps the oxygen-rich blood out to the body, the first thing the heart feeds is itself. 10% of the blood that the heart pumps out comes right back to the muscles so it can work. So these little coronary arteries, they're only 1/8 of an inch in diameter. They're not very big. 3 millimeters is a good sized coronary artery. Sometimes they're 2 millimeters, sometimes they're 4. But anyway, these arteries carry blood to the heart muscle, and they're on the outside of the heart muscle. And this is if you inject latex into the arteries of the heart and then use some type of enzyme to dissolve away the muscle. This is a latex cast of the coronary arteries and all their little arterioles, and then not the capillaries so much, but you can just see it's a dense network. It's like like trees. There are 3 coronary arteries, and each coronary artery has all these branches that come off of it. You can think of the coronary arteries like a hollow tree. The blood flows up the artery or up the tree. The blood flows up the tree and goes out all these branches to the heart muscle. This is another latex cast. This is actually from National Geographic, where again they injected latex very slowly and then digested away the muscle. And then this is a CAT scan we get. This is a cardiac CT scan. You don't see all the little tiny capillaries, but you see the main arteries. This person has a severe blockage in their left anterior descending artery on the front side of their heart. This is the ramus intermedius and the left circumflex artery. These are the cardiac nerves. You can see these nerves go down to the heart muscle. These are the same nerves that go to the aorta, they go to the GI tract, and explains why sometimes when someone thinks they're having heartburn and they're just having indigestion, they might be having a heart attack. And some people think they're having a heart attack, but they're just having an indigestion. You can't always tell. So a lot of it goes into history and doing electrocardiograms and sometimes blood tests and stress tests. Some of the hints are if you exert yourself and you're getting symptoms like indigestion or pressure or tightness in your chest, that could well be your heart. And if you eat a big burrito with a bunch of salsa on it and you get indigestion afterwards, well, that's probably GI, but it's not always clear cut. Here's the electrical conduction system. There is an electrical circuitry to your heart. This is your own natural pacemaker in the upper right-hand corner of the heart that sends an electrical signal to the rest of your heart, 60, 70, 80 beats a minute. And as the electrical circuit travels down, here it comes to the AV node, which is a toll gate, which only allows a certain number of impulses to go through, usually about 220 minus your age. So when you're 20 years old, you can conduct about 200 beats a minute. If you're 70 years old, you're probably around 150 is where you'll max out. You might get a little more, but it's roughly 220 minus your age. Then the electrical circuit travels down your septum. Here's your left bundle, your right bundle. There are 2 circuits here in your left bundle. So you're born with really 3 electrical circuits. All you need is one. If all 3 circuits go, you get a pacemaker. Here's another look at your electrical circuits with your AV node. So here's your natural sinoatrial node. This is your natural pacemaker. Electrical signal comes down to the AV node. Then it travels down your His-Purkinje system to your right bundle and your left bundle, and then out to the heart muscle. And that's what stimulates the heart muscle to squeeze. The electrocardiogram is nothing more than a fancy voltmeter. Okay, so here's your electrical system. So here's your electrocardiogram, here's your voltmeter. And this tells me this little P wave right here is your sinoatrial node, your QRS complex is your activation of your His-Purkinje system and right and left bundle, and your T wave is everything kind of resetting. So we can get a lot of information off your 12-lead electrocardiogram. So this is a normal electrocardiogram. You can just look at that and say that's normal. Here's someone who's having a big myocardial infarction. I had this type of patient actually come in last night around 10 p.m. having a big anterior myocardial infarction. These are tombstone ST elevation, had an occlusion in the artery on the front side of the heart. We did a balloon and stent and fixed it. This is someone who you notice there's not a lot going on here. You don't see a lot going on. This is someone's normal pacemaker, their SA node here, and then there's no QRS. P wave here, SA node here, no QRS. So part of the heart is working and the rest of the heart is not conducting. So this person has a heart rate of around 25. This is when the ventricle squeezes, the atria is contracting frequently. This person has complete heart block and needs a pacemaker. Their heart's too slow, and they'll die if nothing is done about that. This is someone who has atrial fibrillation. About 10% of folks over the age of 65 will get it. Basically, you can see this irregular, disorganized, chaotic electrical activity. It's irregularly irregular, and that's atrial fibrillation. This is ventricular fibrillation. This is death, and this person needs to be shocked out of this. They get chest compressions until a defibrillator arrives, an AED, or paramedics. If you live in a place where there's a lot of folks on the older side of things, make sure there's an AED, know where it is and how to use it. So that person needs to be resuscitated. This is atherosclerosis. These are the coronary arteries. If you slice a coronary artery up, this is atherosclerosis, what it looks like. These are the carotid arteries, and someone who has a blockage here, this is the artery cut in a bread loaf section. This is the plaque in the artery. This is an abdominal aorta with a lot of plaque in it. This is actually someone who occluded off their abdominal aorta. Very hard to do, probably a smoker. It's hard to plug up your abdominal aorta. It's the biggest blood vessel in your body. This is another example of an aortic aneurysm. This is diabetes, smoking, high blood pressure, high cholesterol, not being physically active, eating a bunch of junk, bad genetics maybe. A lot of things can cause atherosclerosis. So arteries are not simply pipes, and do not use Drano or liquid plumber to clean these things. And the other thing to know about atherosclerosis is these plaques do not grow like trees. They abruptly change. They're a little more like Mount St. Helens than a tree, and they abruptly change. So, for instance, when you're young, if you have a unhealthy diet or smoke or have diabetes or high blood pressure, you injure your artery, and when you injure your artery, you get a little white blood cells come in here, you get some injury, you start to get these little fatty streaks on your arteries. Even in 10-year-olds, you'll see that if someone has an untimely death and they get an autopsy, you'll see little fatty streaks in kids, courtesy of the American diet and experience. And then as you get older, you start to get more injury to the artery, and you get these foam cells and cholesterol and inflammation and smooth muscle cells. So this is a plaque. It's like a little pimple in your artery. This is a blood vessel, and you can see this plaque forming in the artery. This is atherosclerosis. And then as time goes on, you get this cap over it. And you get this really progression of this atherosclerosis, and it starts to block the artery. But the dreaded fear is when you get a blockage here and the top of the plaque is ruptures, and the blood sees this inflammation and plaque contents and cholesterol gruel, and whenever the blood sees a roughed up area, it wants to clot. The blood likes a smooth surface, and if you get a roughed up area, the blood will clot. And these arteries are only 1/8 of an inch in diameter, as we talked about. These are the coronary arteries, or really any artery in your body. And if you plug off an artery, or if that clot breaks off and travels downstream, you can have a stroke if it's in your carotid arteries. You can have a heart attack if it's in your coronary arteries. So the goal is to keep those plaques very stable and healthy. So this is what it looks like. This is an artery. You start to get restriction here. Get more restriction with more plaque, and then sometimes it'll clot off. And then you have troubles depending on which part of your body depends on that artery. In the coronary world, this is how we fix it with little stents. You can see they're not very big. They prop open, scaffold open the artery. This is what a heart attack looks like. I'm sure Brian showed you this earlier this month. This is a coronary. This is someone having a big heart attack where the coronary artery is occluded down here. You can do a balloon inflation here, and then afterwards, you fix the artery, open the artery, and if you notice, there's good blood flow down to these arteries now where they were not here. This part of the heart muscle that depends on these arteries is now much happier. You reestablish blood flow. Hopefully you salvage some heart muscle. This is called supraventricular tachycardia. This is an electrical circuit issue. This is where the heart goes very fast and regular. There are different electrical circuit issues here where sometimes you have these slow pathways and fast pathways. The electricity can go down one and back up the other, and it becomes like a rotating thing where your heart can reach up to like 180, 200 beats a minute. And there's things you can do to interrupt that, like bearing down. Sometimes you go to the emergency department and get some adenosine, and the electrophysiologist, our electrical specialist, can take a catheter up the vein up into the heart. This is a catheter, this gray thing. They find where the extra circuit is, they deliver some radio energy and cauterize it or zap it. So that's an ablation procedure when you have electrical circuit issues that can be interrupted with a catheter. For pacemakers, this is for worn out circuits. This was the original one back in the 1950s. You can see how big it is. This guy is wheeling it around. This is the pacemaker right here. And then, you know, a lot of pacemakers now are this size. This is a battery with a little computer chip. And then there are these wires that travel down the vein and screw into your heart. This is what it looks like. This is in your left chest. The pacemaker leads travel down the vein, down into the heart, and attach to the heart. And now there are newer pacemakers called micro pacemakers, which are smaller, about the size of a nickel, and they just get implanted right into your heart, right like that. So you don't have all these pacemaker leads. It's not for everybody. More common in atrial fibrillation, you can use that, or folks who are not very active. This is not for everybody. It's probably a minority. And there are also MRI compatible pacemakers now, which is quite nice. This is a defibrillator. This is implanted beneath your left subclavian vein, usually right here. This is again a battery with a capacitor and a computer chip. This will build up a charge here, and this is monitoring your heart rhythm 24 hours a day, 7 days a week. And if you have a life-threatening heart rhythm, it will try to pace you out of it or charge up and give you an electric shock if you have an unstable rhythm. It's like having a paramedic next to you. This is usually for people with weak hearts or certain types of unstable, life-threatening circuits. So for atrial fibrillation, a regular rhythm, the dreaded fear of atrial fibrillation is stroke. This is a CT scan where part of the brain has been injured because a clot has traveled up to the blood vessel that supplies this portion of brain with blood. This is a hemorrhage into the brain. This is again a CT scan with the skull, the brain inside, and you can see all this blood, and it's just compressing the brain, and that person undoubtedly died. And this is the dreaded fear of stroke. 30% of all strokes are due to atrial fibrillation. If you have atrial fibrillation, if you're going to form a clot in your heart, the most likely place by far to form it is in the left atrial appendage. This is a little windsock on your heart. And if you do a latex cast of the left atrial appendage, this is what it looks like. Look at all these little tiny channels. You can see how if this part of the heart is not squeezing, which is the case in atrial fibrillation. When you have atrial fibrillation, you have chaotic, disorganized, the atria of the heart has shorted out, and that portion of the heart is not squeezing anymore. And when that portion of the heart is not squeezing, the blood can stagnate. And if the blood stagnates, it can clot. And if the blood clots in this portion of the heart, it can travel out of this area through the heart and pump it up to the brain. And you get a stroke then. So you can see there's all these nooks and crannies for clots to form. That's why people go on blood thinners. So this is an example. This is a transesophageal echo of a left atrial appendage where clots can form. This is normal. If you go over here, this is what a clot looks like. If that clot breaks out of here and goes up into the left atrium and then out through the heart up to the brain, you get a stroke. So there's a big clot sitting in this person. That's why we give people blood thinners. So that's why people get warfarin or Coumadin. They might get dabigatran, also known as Pradaxa. They might get Xarelto. They might get Eliquis. Or we do Watchman devices for people who have bleeding issues. And this is a little device that gets placed at the opening of the left atrial appendage in order to seal this off. So this left atrial appendage is sealed off and there's no communication. And then you're less likely to form a clot. Smartphone.